next guest is back, and we love her. And today she's talking about caring for the mind and the body, because honestly, they really work together.
They really do. We are here with Dr. Amber Edwards again. She's a heart surgeon at Ascension St. Thomas, and we are talking today about heart health and mental health. Dr. Amber, can you please explain how these two work together?
Sure. Well, that is actually a two-way street. So depression and mental health disease can make you at increased risk of cardiovascular disease. And if you have a cardiac event like a heart attack or open heart surgery, you're more likely to have depression or other mental health disease.
Oh my.
Okay,
so if one goes off, another can go off?
Yeah, it's very interesting.
Whew. Yeah, and we've got this graphic that kind of shows that cycle you were talking about.
Yeah.
Wow.
Okay.
That's interesting. Now, tell me a little bit more about the theories or the research behind this connection.
Sure. So one kind of obvious thought is that when you have depression or other mental health disease, you're less likely to make positive health choices for your physical health. You're more likely to not eat well. You're more likely to have poor sleep. You're more likely to engage in drinking, alcohol, more likely to smoke, those sort of things. And then there have been studies that looked at all of that and taken the behavioral things out, and depression is actually even still an independent risk factor for cardiovascular disease, and that may be due to the cortisol system in our bodies.
Oh, so you're talking about like the actual chemicals that
Exactly.
circle our bodies.
Yeah, like neurohormonal.
Oh.
And I would imagine that anxiety with your heart pumping all the time, that it definitely affects that.
Yeah.
You know, obviously you're a very busy mom, Dr. Amber, but you find the time to work on both your mental and heart health. What are some tips that people can put into place today?
Well, start small. If you're not doing anything, then don't try to go take on the whole world. I tell my patients that all the time. The way that you change your overall health is to make small adjustments once at a time. So, you know, if you want to stop drinking sugary drinks, then pick that. If you want to start exercising, then do something that makes you happy. If you hate getting on a treadmill, don't try to run on a treadmill. Go for a walk outside. Engage with your pets if you have them. Involve your significant other or your family.
And I think going for a walk outside or doing anything outside, I think someone was talking about it last week that was on our show about how it kind of scientifically like grounds you a little
Exactly,
bit.
yeah.
Even more so than like on a treadmill indoors or something.
Yeah.
I like that idea.
And I love that you say start small because, you know, let's say you want to work on that mental health and you're like, okay, well, I'm going to work out 5 times a week, I'm going to stop smoking, and I'm going to give up all this. You could just crash, right?
Exactly. It can be overwhelming.
Yeah.
I can also imagine that someone who thinks they're doing really well in life, who then has a heart issue randomly or a heart attack, that would probably set them off on being kind of depressed and anxious. So I kind of see that circle you're talking
catching
about.
on,
yes.
yeah.
Now, right now, why is right now so important to deal with this and talk about it?
Well, I think we are seeing more mental health disease than ever before, particularly after the pandemic, and it became under a magnifying glass that people were having a lot more depression and anxiety. And you know, 8% of the U.S. population has depression, and 1/4 of the people who live in this country have a mental health disease. And we all know that cardiovascular disease is the leading cause of death. So there's a lot of the population at play when we talk about this.
When we saw that increase in depression and anxiety during and post-pandemic, did you see an increase in cardiovascular issues as well?
We don't really know yet.
Oh.
I think that is still being worked out. We certainly did not see any slowing down of that.
Okay.
But how much of that is related to that particular element, we're not sure.
Okay. All right. Well,
thank you so much. Those
such
are
good
great tips.
information. Yes.
And something to just think about, even if you're not going to go run outside yet, think about it. Get started small.
Steps, baby steps.
You can check out more about cardiology and care at Ascension St. Thomas online. Visit healthcare.ascension.org and check them out on social media.
Next.